Hello, sir. So, I have some few questions regarding integrated medicine. So, first of all, I would like to start that my mother is very fond of homeopathy. That whenever my family used to get sick, she would always give us, okay, take it. And there is a phrase very much, connected to homeopathy is that जड़ से चला जाएगा. Hope we all have heard that homeopathy खाने से जड़ से चला जाता है. So So there are so many homeopathy comes with lots of doubt, like there are so many misconceptions because it is not widely accepted in the world yet. But still you manage to make it so big in India. So what are what were your challenges and what were your learnings?
So first of all, thank you very much for having me here. Also, my family namesake, Anurag. I don't find him here, but thank you. And also to Mr. Narula and to Businessworld. It's really a pleasure to be here. I'm, happy to be part of this fireside chat and also remove some misconceptions. So let me first say that, homeopathy is actually the second largest system of medicine in the world, according to World Health Organization, and it's actually growing at 25% back to back. So it's actually pretty popular. It's legally followed in about 175 countries of the world. So it's not just in India, even though India is actually the largest base for homeopathy because there are more than 50 million followers in India and there are more than 2 lakh homeopathic doctors who practice homeopathy. So it has the largest base, but it's all over the world actually. So it's not just restricted to India any longer. And we are also not just in India, but my company is already in 6 countries of the world, in the UK, in Middle East, and many other countries as well. So I think to answer your question, that it's actually pretty popular in any case, but we've added a small bit in whatever we could do. And yes, going into new terrains and new geographies, there are always many challenges. So the first challenge that we've had is actually of legislation. So I'm now talking about 1996 when I set up my first clinic in Mauritius. When I went over there, I requested the vice president to inaugurate my clinic. And he said, if I come there, I'm a bar at law, I'll put you behind bars. Because homeopathy is not legalized and I've put another Ayurvedic doctor like this. So, I had to go up and down almost 6 months to actually legalize homeopathy in Mauritius. And so ours was the first legalized clinic in 1996. So that's the first challenge in some parts. In the Gulf country, for example, because homeopathy is alcohol based in terms of dispensing it, so it was banned and it was not allowed. So that's really the first challenge is legislation. The second challenge is registration of doctors. So while doctors, while we have a 5.5-year course in India, but doctors have still to appear for another exam on a medical board, either in UK do another, kind of a course for 6 months, or in Middle East, they have to appear before a medical board and then answer questions and appear for exams. And only when they pass it do they get a registration. So that's the other challenge also there. The third challenge, of course, is infrastructure setting up. It's not easy at all to set up infrastructure in a new country. Very often the licensing procedure is very, very, for health and food is very regulated abroad. So the licensing procedure takes very long. Sometimes it can take even 1.5 years, 6 months to 1.5 years. So you actually have a lot of capital investment over there because you have to block all your money for another 6 months to 1.5 years. You have to pay top salaries to your doctors and your consultants, and you can't practice. So there's a lot of capital that goes in without any return. So you've got to be able to hold on that for some time in a foreign country. It's not easy at all. And then, of course, there's a cultural difference because, like for example, in Middle East, people dress differently. They have different cultures. You can't actually shake the hand of your female employee. It's just not allowed. And so there are lots of other things like this as well. So it is a challenge. And of course, the challenges again of acceptance. Like for example, in London, we're not allowed to advertise. There are lots of very strict rules when homeopathy is very popular there. But you can't advertise in newspapers about the goodness of homeopathy. There are lots of restrictions on the claims that you can make all over the world. So I think these are some of the 4-5 real challenges. But I think, where there's a will, there's a way. I'll end by just saying that little, poem that I remember. Kadam choom leti hai manzili aakar, कदम चूम लेती है मंजिल ही आकर अगर राही खुद अपनी हिम्मत न हारे. So I think, it's just lage raho Munna Bhai, as they said in Munna Bhai MBBS movie. Just have to keep at it and keep going, and you'll get there. If you have the will, you will find a way how to get there.
Thank you, sir. That was very informative. And so, how is homeopathy is going to play a very important role in integrated medicine in India, like with the holistic approach?
So, the largest number of deaths that take place today are not for communicable disorders, for which allopathy has done extremely well. It's actually for non-communicable disorders, NCDs as they are called. And there are more than 25 million people that die in India alone of NCDs every year, which is chronic disorders. And this is really where, because these are lifestyle problems, this is really where homeopathy and alternative and complementary Ayush treatments have actually an edge, because they are holistic in nature. And so you can actually treat them successfully with very little cost, and also you can integrate them very easily into other systems of medicine. So this is like the gap. No system of medicine is complete by itself, and this is the gap that can be easily filled in through homeopathy and other systems of medicine, Ayush systems of medicine, because uh, chronic problems have, they are normally holistic. So they are multiple reasons for it. So for example, when you have a disorder which is say an infection, it's normally because of one virus or one bacteria, single. So it's easy to treat it by an antibiotic if it's a bacteria, and otherwise also, through a virus you can manage it. But if it's multi-pronged, like how it is in a chronic disorder, because it's lifestyle related, there's no exercise, there's poor diet, there's stress, there you need holistic medicine, and which is where homeopathy comes in. So one thing is that it can be very well integrated in as part of holistic medicine in chronic disease. The second thing is that it can also form a very strong basis of preventive medicine. So even in preventive medicine, homeopathy is very, very good. And we saw that in Ayush as well during COVID. The government recommended arsenic alb as a preventive medicine. And in my company, we gave 2 crores free to all the police force of Maharashtra and their families. And there's a lot of examples like this, even earlier of epidemics, where homeopathy has been used very successfully. You know, even in Japanese encephalitis, Andhra Pradesh used it. They gave a dose of belladonna, and nobody actually got that brain fever, as it was called, and children didn't die. So on the preventive aspect, and on the, I would say, the curative aspect of chronic diseases is where it can easily be integrated.
Okay, thank you so much, sir. Uh, sir, can you tell me about what are the there is several misconceptions related to homeopathy. So what are the 3 you think it should be busted? 3 misconceptions you have to tell us.
Okay, there are so many that we'll be here for lunch and for dinner and probably for breakfast as well. So it's good to actually to remove
That's
them.
why I just
So
said
only 3. So the first, of course, is that it is slow, because people think that it's a slow system of medicine, takes very long. But this is actually not true, because it's because people who come to homeopathy come because of chronic problems. They've suffered from migraine for 10 years and they have arthritis for 20 years and so on and so forth. So anything which is acute, like a cold or a cough, it gets all right very quickly. But anything which is long term and chronic actually takes a lot of time, because, as you said, jar se mitata hai, it treats from the root, which is why it takes time. So, like I said, that's the first myth. The second is, of course, that also that it is herbal medicine, which it is not, because homeopathic medicines are actually prepared from multiple sources. You can prepare it from sun, from silica, from mud, from even from certain animals, and even though a lot of it is plant medicine. So there's a misconception that it's just plant medicine. It's not. And the third, of course, a very controversial thing is also that it's a placebo effect.
Yeah,
That
this
वो
is-
अगर
yeah.
अगर उसमें आपका faith है तो फिर it works on faith.
हाँ.
And but it's very, very good for in veterinary medicine. There's a lot of research that has been done, and animals don't have any faith. You just give them whatever it is. I'm saying I've used it for all my pets very successfully. I've trained a lot of veterinary doctors as well. 50% of veterinary doctors in UK actually use homeopathic medicines on their patients, on their animals. So it's very good for animals, very good for babies who have no faith at all. And now, of course, there's a lot of clinical evidence that has been also available to show how homeopathy helps. So that's also a myth.
Okay, that's good, sir. Um, so, like, what are the policy changes will you advocate for so that we can easily integrate medicine for better healthcare in India?
That's really a very difficult question because sometimes, the government has a very thick skin and no matter what changes you recommend, it doesn't get implemented. I would say that, like, for example, when you talk of business and you talk of, retail health, and there are so many doctors and industrialists over here, the first thing that they say is that in retail health, there are three things that are required for a successful business. And the three things are location, location, and location.
Okay.
So the same thing I would say is that for integrating healthcare of all systems of medicine, what is really required is awareness, awareness, and more awareness. And therefore, this awareness needs to be created at different levels. The first is with the government. Like I said, now, I am the chair of CII on Ayush, and we present white papers to the government to kind of, sensitize them on the need of Ayush and how it can be used. Recently, you know that the CGI has announced that there will be an Ayurvedic clinic for all the people of the bar, in the Supreme Court, and they can benefit from there. So a lot of such things keep happening. There's a long way to go, but we do kind of keep asking the government to make policy changes in favor of Ayush and in favor of homeopathy. It's a slow process, but we are getting there. So this is the first thing. The second thing, of course, is to also synthesize the medicine, the medical fraternity, because they also have certain ideas about homeopathy and other systems of medicine, and to actually show them through clinical provings that homeopathy actually works. And that's the second thing that we have to do, to go to the medical profession and to open their minds into other systems of medicine as well. And the third, of course, is again to go to the public, because we need more awareness. I mean, if after homeopathy is now 225 years old, I can still be asked a question that homeopathy is slow and does it work or not work, then there's a lot of ground level work still to be done in popularizing and removing the myths that are there against the system of medicine.
Okay, sir. Thank you so much. And sir, what are your aspirations for how, like, where do you see homeopathy in coming years? Like, do you see more, like, because it comes with definitely lots of doubts. So, how are you going to, make a mechanism where people accept it, the way allopathy and other uh, Ayurveda things are doing? But how is homeopathy is going to do that?
So, first of all, like I said already, that it's already being practiced in 175 countries. And so there's a lot, it's already being practiced almost everywhere. So any country that you can think of, homeopathy is legalized, it is being practiced. There's not much to be done there, except that you have to formalize it, you have to, put it on a platform of, make nice processes and systems, do clinical provings, and so on and so forth, and add to research. But otherwise, it's already recognized, and there's not much that one can do over there, because there are so many local homeopaths who are practicing in different countries, and it's being popular. Like I mentioned to you already, that it's not Ayurveda; it is homeopathy, which is the second largest system of medicine in the world. So that's again a misconception, and it's growing 25% back to back for the last 5 years, compared to pharma industry, which is growing at 10%. So it's catching up very fast, and also it's not the oldest system of medicine. People think of it because they associate with Ayurveda. It's actually the youngest system of medicine in the world. It's only 225 years old. So it's the youngest system of the medicine, and it's the fastest growing, and it's the most popular. So it's doing pretty well on its own, and I don't think much needs to be done. It already has a momentum, and this momentum will be accelerated. And I think just creating more awareness, creating more of a consumer pull, making more and more people aware that of the benefits of homeopathy and why they should try it out. I think that's what needs to be done. Like I said in the beginning of my talk, that
Conventional therapies.
I mean, they would be the same as any other system of medicine, because medicine is medicine no matter what it is. And the ethical things would be said. But I would just point out two. Number one is transparency, particularly for homeopathy, because lots of homeopaths don't divulge the name of the medicines they're giving. And therefore, there's no transparency. And that can really become a hindrance if one is going to go for integrated medicine, because you need to have transparency with the treatment that you're taking. You need to have patient awareness in what they're, as part of the build up of a doctor-patient relationship, trust that you build up over a period of time. So number one, I would say, is transparency. That's very important. And number two, I would say, is data security, because the information that you get uh, in a homeopathy case taking is far more than what you get in just a clinical evaluation in allopathy. There are a lot of personal data. There's a lot of not just medical data, but there's a lot of personal data of social problems, family problems, mother-in-law problems, daughter-in-law problems, all which are told in confidence to the doctor, and that's not something that should leak out outside. So I think data protection and keeping those files very safe when you're sharing it with anybody else, I think that's going to be a challenge.
So, tell me one thing: are we coming up with more institutes which are going to teach homeopathy in that, like in education? I'm talking about. Do we need that more?
So I don't think we need that more. We already have 175 institutions in India. I think we have too many of them. What we need to improve is the quality of education, very clearly. The quality of education is really not power. I would say that in my company we have 400 doctors, and we actually choose doctors only from the top 10 or 15 universities in India. As you know, that homeopathy is a graduate course. It's a 5.5 year course. So 5.5 years is a long time for somebody to learn medicine, not long enough, of course. After that, you then have a 3 year MD course where they can super specialize in pediatrics or in any other such, or in psychiatry as well. I'm just giving examples, but there are
Okay.
many like this, and also in advanced homeopathy. And that's another 3 years. So then that's 8.5 years again. And then we have a Dr. Batra's Academy, which is actually the first public-private partnership with Mumbai University Health Sciences. And we conduct a course for MD doctors and for doctors who have more than 15 years on clinical dermatology and homeopathy. So they do another 1 year in that. So if you actually look at it, the education is almost 10 years before you really qualify to actually be a practicing doctor, which is a lot.
Yes.
But it's just that while there are 175 colleges, all of them are not standardized. So
Okay.
standardizing education and making sure that the facilities of in all colleges are the same and good and on par, that's the need of the hour. So the need of the hour is to improve what we already have and not open more colleges. I mean, there are enough colleges. There are like 20,000 doctors who pass out every year from all these colleges. But are all of them equally good? No. A lot of them we have to retrain them again before we actually put them into practice.
Yes, sir. Thank you so much, sir. And how is homeopathy is going to help people who are suffering from anxiety or mental, psychological issues? How is that? Do we have therapies there, or like how does that work?
So there are two thoughts in that. Number one is that today a lot of problems today are psychosomatic. So for example, if you get a headache or a migraine, it could really be, of course, it's a neurological problem, but it could also be because of anxiety or pressure or stress at work or anywhere else. So today a lot of problems are psychosomatic, and therefore going to a physical manifestation of a problem which you see, also with a mental manifestation which is hidden. So there's some psychological pressure which is actually causing it. So a lot of problems are psychosomatic. Because homeopathy is holistic, it actually helps in that. Similarly, also helps in a lot of mental issues and emotional issues. So things like OCDs, anxiety, depression. Actually, my next book on homeopathy is on homeopathy and mental disorders, and I'd rather wait for it to come out. It's already on pre-order on Amazon, but the first delivery will be on 18th of March. So you can read a lot about it, because I mean I've written a whole book on it, so there's a lot to talk about. But it would suffice to say that yes, homeopathy has very, very good treatment for so-called mental disorders and also emotional health problems.
Oh wow! Because in allopathy, it is generally said that people who have medicines, they rely on that. They become addictive. So, so how is homeopathy is going to be different from this medicine?
So, every system of medicine has its advantages and it has its limitations. That's why I never like to talk about any system as not being good or being bad. It's always, there's a limitation, and it's for the consumer to actually pick up the best and understand what will work for him in that case. Similarly, different treatments of medicine work differently during or are recommended during different courses of the same disorder. So, for example, in some cases of cancer, you want curative, you want to do surgery, you want to do chemotherapy, radiotherapy. In some cases, it's only palliative treatment. So, palliative treatment is far better in homeopathy because it is safe, it has no side effects. So, similarly, also in so many, like psychiatric disorders as well, whether it's depression, whether it's OCD, whether it's schizophrenia, whatever it is, you're already taking chemical medicine.
Yeah.
And you can't stop it suddenly, because then the patient will go, have that one moment of madness and commit suicide. I mean, can you imagine that almost 7 lakh people in India, young people, commit suicide,
Yeah.
you
Yes.
know, and it's now getting more and more common. So you have to gradually withdraw it, and you then have to introduce homeopathy, which is non-addictive and has no side effects. So over a period of time, then you can actually be healthy
Mm.
and happy, and not depend on chemical medicine. But
Okay,
you
sir.
can't do without it suddenly. If you're already on it, you have to taper it down.
Yeah. So I would like to ask question about the business of homeopathy, sir. Like, how is it? Is it as big as the other
Well, there's
sections?
nowhere near
Hmm.
pharma industry or the allopathic industry. There's nowhere near the hospital industry. These are all small players who kind of coalesce together. I would just say, we are just like the papad industry, and then they just came together and put them together on a platform, and then gave a kind of a platform for people to earn money and to get to the consumer, so that they could choose. And I think the industry is very small. Having said that, the larger industry is the homeopathic OTC industry. So if you look at it, it's divided into service industry, which I'm saying is very small, limited, because even though there are doctors, but abroad there are very few doctors
Hmm.
who are qualified to practice and registered. Abroad, for example, in Europe, you have to be an MD doctor, and then only you can practice homeopathy. So it's quite different. It's not easy. But here, there are lots of service doctors, but there are not so many OTC products. So the entire industry abroad runs on OTC products. So you can go into a Boots pharmacy, for example, and you can pick up a homeopathic medicine for migraine or for backache. So it's off the shelf and off the counter. And that's where the industry is growing very large. It's, I think, to my knowledge, it's about a 3 billion US dollar industry already, and it's already growing fast. So homeopathic products in terms of OTC are growing very fast and are getting bigger, but not the service industry.
Okay, sir. So, sir, we have heard a lot about you. We know, like, you have, uh, like, great journey. तो सर कुछ ऐसी बात कह दीजिए जाते जाते, या तो गाने में, या कि, कि मतलब सबको मजा आ जाए. Please, sir. I know you paint, you do lots of creative things and good things also. So yeah, please sing.
My wish, Binder, I can see time's up, so
the challenges that he has faced personally, and then taking on the journey which was very very different at that point in time, to do something in homeopathy, and then taking the initiative to do something which gets the attention for the subject, and taking it beyond India. And so you're कुछ ऐसा गाना, something that you would want to sing, which demonstrates the learnings of life beyond just homeopathy.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है, जीना इसी का नाम है. So that's it.
Fantastic.
I think if you reach out with love and care, the world will reach out back to you and you'll get where you want to be.
Awesome.
Thank you very much.
Awesome. Thank you so much, Dr. Batra. And I have one question. I mean, I'm taking this opportunity to ask this question specifically because we have so many CEOs of hospitals and people from AHPI here. So we are talking, I mean, the sense that I'm getting, I interview a lot of people. And one sense that I'm getting from the industry is that we are heading towards integrated health. We're talking about outcomes, focus on outcomes rather than whether it's going to be allopathy, homeopathy, Ayurveda. So, what is it that we can do so that hospitals take attention and can include homeopathy as a treatment option in their hospitals? And they go beyond just thinking that, we are an allopathic hospital or we are an Ayurvedic hospital, can it be, do you think we can be a hospital which is offering integrated services more focused on outcome and on the delivery of what is going to work for the human body?
Actually, that's a very difficult answer. It'll need another discussion. Let me try and just be very brief. So the first thing is, we're already doing this. I've introduced homeopathy as a super specialty in many hospitals. We've been part of the KIMS hospital in Bahrain, for example, for the last 16 years. And we have half a floor there, which is Dr. Batra's homeopathy over there. So we're actually part of this whole system. Similarly, was part of an orthodontic clinic for over 5 years in Dubai, because we found that a lot of kids over there who were coming with, misalignment of teeth and needing treatment, that they actually were mouth breathers and they had adenoids. And so with homeopathy, we could raise their immunity and treat them with for the adenoid problem. Similarly, we were also part of one of the largest bariatric centers, because they found that people who were undergoing bariatric surgery needed a lot of counseling and they needed a lot of care, because they were very anxious with what they ate afterwards, very anxious that we'll be put on weight again. So for many years, we were with that group as well. Presently, we are also now with one of the largest IVF centers and infertility centers in Greece, in Athens, where when they get stuck with certain patients, we treat them through homeopathy in cases of infertility and sterility. So there are already examples like this all over the world. Now, having said that, there are many challenges. So the first challenge is one of nomenclature. So, for example, how do you classify the disease? And second thing is that how do you treat it, and how do you standardize, methods of evaluation and medical outcomes. Now, we've done both at Dr. Batra's. Number one is internationally, we follow what is called ICDs. So the International Classification of Disease is what we follow everywhere. So not that somebody will call it an allergy and somebody will call it an allergic bronchitis, and then somebody else will say it is Vata and Pitta, and somebody else will say, no, it's just a immunity problem. Now, when you have different names for the same problem, you can't have a common ground. So the first thing to do is to create international nomenclature, which is accepted all verticals of different things. Second thing is then also to make sure that how do you measure the outcome? So homeopath will say there's a wellness. I'm feeling better, so I'm all right. Somebody else will say, Ayurvedic doctor will say there's no symptom. I'm all right, he's free. And a medical doctor will say, I want it to be clinically evaluated. So making sure that clinical evaluation is mandatory across all systems of medicine and standardized. For example, if you have an asthmatic patient or a CPOD patient, COPD patient, don't tell him that he's okay unless we do a pulmonary function test, which is electronic in all our clinics. So if you measure the breathing capacity before treatment, after treatment, and you see that it's become all right, that's how so I think we follow these kind of protocols, medical protocols across the world, and I think everybody needs to do it. So we are a far way off. I'm saying once we start getting the nomenclature right, and we start talking the same language, and then we start talking the same language in cases of medical outcome, I think that's when really integration will become, a possibility.
Thank you so much, sir.